Hello, everybody. Welcome to Charkos YouTube live session. And I'm Dr. Anusha Bharat, OET trainer with Charkos Global.
I'm Nagashree S. Vivek, OET trainer with Charkos Global. Well, we are super excited to launch our first episode of YouTube live classes. Before we actually start with, we would like to give a brief introduction about Charkos and an introduction to OET.
And please do let us know in the comment box if you're able to hear us and able to see the shared screen.
I hope we are audible. A hearty welcome to you all for the first session of our YouTube live classes. We hope that you will have a great learning experience. Well, Dr. Anusha, shall we start the session?
Yes, we shall right away. So, can you please tell us a little about Charkos?
Sure. We are a one-stop solution is what I can say. We are a one-stop solution for education, training, recruitment since 15 plus years. We aim to provide international career opportunities and to support you as your partner in every step of yours as a healthcare professional. Well, could you please introduce the viewers about OET?
You see, OET is an acronym for Occupational English Test. This is an international English language proficiency test specifically designed for healthcare professionals, those who seek to work in English speaking countries, and your communication skills are assessed on 4 modules. We'll come to that soon. To whom does it cater?
Well, nursing, along with 11 other professionals like medicine, optometry, podiatry, veterinary, dentistry, pharmacy, radiography, dietetics, occupational therapy, speech pathology,
and physiotherapy. So, the structure of the test is like this. You're assessed on 4 language skills, as you can see on the screen: reading, listening, writing, and speaking. And each module reflects real workplace scenarios in the healthcare setting. So, as a healthcare professional, it becomes really easy for you to work and solve all the problems that appears in these modules.
Well, that's interesting.
It is. It is a very interesting exam, actually.
Oh, could you please throw some light on the scoring and results?
Sure. OET is scored on a scale from 0 to 500. And as you can see, it is graded from A to E. E is the lowest grade and A is the highest. If you are scoring it between 450 to 500, then that is an A. But you should know that a minimum grade score of B is required. That is 350 and above is required by most regulatory bodies. And it depends on the modules as well. For example, in the UK, you're expected to have a B grade in reading, listening, speaking, and a C plus, that is, your scoring should be between 300 to 340 in the writing module.
Oh, thank you. It was informative. Well, when we look at the recognition, the OET is recognized by regulatory healthcare boards and councils, hospitals, and universities in several countries, including Australia, New Zealand, United Kingdom, Ireland, Singapore, Philippines, Dubai, Qatar, Spain, Canada, USA, Finland, Maldives, UAE, Ukraine, Sri Lanka, Malta, and Egypt. Well, how to book an exam?
You see, you can register for the OET exam through the OET official website. You require a few documents like your passport, and the other criteria is stated in the website as well. The test is offered twice a month. One slot is for nursing and medicine, and another slot is for all professions. So you'll have access to the exam 24 times in a year, and it is conducted at test centers around the world, recognized test centers. So you don't have to worry about anything else, malpractice or anything. The OET exam fees comes to around approximately 33,000 Indian rupees, and the certification is valid for 2 years.
Well, I'm super excited to know what are we learning today.
I'm excited too to tell our viewers about today's module. Today we'll be looking at the writing module. All right. So the writing module is integral to an OET exam. It tests your comprehension and précis writing skills. So in the writing module, as I already said, some bodies, regulatory bodies, want you to score a C plus grade in writing. So if you have to get that score, so how do we go about? How do we tackle the writing tasks? We will be looking at clinical cases, or what we call as case notes in the healthcare terminology. In today's class, specifically, you will be learning the types of letters. And all our viewers, a request to you guys, please make sure that you have a book and a pen with you so that you may note it down. And any questions that you have, you may always post it in the comment box and we'll get back to you immediately, right? So as I was saying, in today's class, you will be able to learn the types of letters, understand what the writing task is about, because the writing task, that subheading, is for the questions per se. You will be able to learn how to select relevant content, put across information, important, relevant information without clogging your paragraphs, how to recognize distractors in the case notes, and understand the paragraph requirements with respect to different types of letters. Last but not the least, we'll also be telling you how to use connectors and adverbs of reason effectively.
I think the class will be more interesting.
Hopefully.
Well, let us begin with the types of letters. Well, there are 4 types of letters in the OET exam. The first one is the referral letter, which is the most common letter. Second, transfer letter. Third, continuity of care letter. And the last one is an update letter. Well, please explain referral letter.
You see, I'd like to take up referral letter and transfer letter together, because these two are pretty similar in their organization, right? So the referral letter and the transfer letter, you may note down these points. Almost all the details relevant to the patient's condition is to be included in these letters. So when I say almost all the details, I don't want the candidates to get confused as to saying, do I have to include every detail that is given in the case note? Well, that's not what I'm talking about. Almost all is nothing but majority of it. So you will have to, select pointers. You'll have to select details relevant to the patient's condition and add it in the paragraphs required. And the other point to be noted is no changes in the paragraph requirements. When I say that, you will understand what I mean when we come to discussion of the paragraphs. We'll be writing 4 paragraphs, and you all should know that the word limit for the writing module is 180 to 200 words. It can exceed a little up to 205 or 210 words. You will be getting one sheet. You'll have 2 pages, and your letter should be well within that. Okay, so you'll have to practice accordingly.
Well, we will look at the transfer letter.
Yes. As I was saying, here as well, you will be including what happened to the patient, what you want the specialist to know about the patient, the current medications related to the patient, the past medical history of the patient, and the suggested treatment which is given in the discharge plan.
Well, in the continuity of care letters, there are three scenarios. There are possibilities where you will be sending back them to a nursing home. There are possibilities where you will be sending back to the patient's home, exactly, or back to the family.
Exactly.
So, well, we will discuss it later in detail. There is an important information regarding an update letter. It is quite little confusing because most of our candidates get confused how to decide whether it is an update letter or if it is a referral letter. Well, the update letter is always written to the patient's general practitioner, who is also known as primary care physician. There are cases where you will be asked to write a letter to a general practitioner in general. Then that would be a referral letter.
Well, that's a very good point. Thank you for that, Ms. Nagshri, because most of the times we see students who are worried about, once you get the addressee being a general practitioner, they get confused. So I hope this confusion doesn't happen from now.
Yes. Well, when we look at the paragraph requirements, could you please highlight what is important to state in the first paragraph?
Sure. You see, the first paragraph is, sets the tone for your letter. So it states the purpose. The purpose has to be clearly set. You're not supposed to give us all details of the patient in the first paragraph. So here, basically, you'll be answering 3 WH questions. And these questions are who, that is the name of the patient, what, the problem or condition of the patient, why, that is the reason for writing to the specialist concerned. So these 3 WH questions, if it is answered, that would be sufficient. Along with this, if the discharge details of the patient is given, for example, the patient may get discharged the same day or may have been discharged the same day, or the patient may get discharged after a day or two. So in which case, that is because of the specialist's report which is pending. In such cases as well, you'll have to state it in the first paragraph. So let us just look at an example. Let me just give you an example. For example, the patient can be Mrs. Smith, and the problem may be left knee fracture, which she is recovering from. You have treated her as a nurse, and the patient is recovering from the same. You are writing probably to the director of a rehabilitation center. All right. So keeping this scenario in mind, let us quickly frame the purpose of the letter. I'm writing to refer. I'm taking the example of a referral letter here because you're referring the patient to the specialist, right, at the rehabilitation center. So I'll say, I'm writing to refer Mrs. Smith, who is recovering from a left knee fracture. She requires further care and management from your facility, and the discharge date, if it is given, I'll say she will be discharged today. This is an example of a purpose, and this changes. Only a few things change in between, but the basis remains the same. Who, what, why, plus another question, when.
So it has to be crisp.
It has to be.
Please keep in mind that you are not elaborating or trying to fill in so many information in this purpose. It has to be crisp and it should answer these 3 questions. Well, when we look at the second paragraph, so it states that we have to state the current medical condition.
Yes.
So it should start with the admission details. So we can start. So Mrs. Smith was admitted on 2nd July 2018 with the presenting complaints. If the patient was presented with following a road accident, you would say that. Or if there are any other complaints as such, you would mention that. And definitely, once the patient gets in with some problem, definitely an assessment would have been done. So you will write about the assessment, diagnosis, the treatment given, if at all, if any medications have been commenced on, or if there are any complications, you would be stating that. And it is very important to state the current status of the patient. For example, the patient would have been admitted, the treatment would have been started, the patient would have been responding in a good manner. The patient, for example, if the patient has been admitted with following a road accident with some injuries, might not be able to move during the admission, but during the hospital stay, if it states that yes, the patient is able to move now with the help of crutches or something like that, then you would say Mrs. Smith is able to mobilize with crutches. Yes. Mrs. Smith has made a good progress.
Yes.
Okay, would you please tell me, is there any mandatory that we have to mention in one paragraph, or if there are any cases where we find many informations which we find that it is important? So can we split that into 2 paragraphs?
Definitely. Now see, some students get really confused when the nursing management timeline is pretty long and you have to deal with multiple dates and scenarios. So in such cases, what you can do is you can clearly divide your second paragraph into 2. You're not writing subheadings any which way. So you can call that for your own reference as the first part of the second paragraph and the second part of the second paragraph. So that gets divided into 2. So here we are going to deal with only 4 paragraphs because that will keep your letter crisp and to the point, and it will also remain very accurate. And an additional paragraph would only be required if the timeline, that is the nursing management, is pretty long and in detail. That's only then we'll need to do that.
All right. What about the next paragraph?
So the third paragraph, as you can see on screen, we have given 2 options. So in these 2 options, we are going to divide it. As I already said, a referral letter and a transfer letter are pretty similar in their organization. So in these 2 letters, you should state the past medical history and the social background in your third paragraph. So here also, please keep in mind that you will be talking about the past medical history first and then the social or the lifestyle background. For example, it can be Mrs. Smith has a medical history of hypertension, type 2 diabetes mellitus, and asthma since 2000, 2002, and 2005, respectively. This puts the medical history in place. And then you can also talk a little about her social or lifestyle background, something on the lines of she has been a smoker for the past 40 years.
Okay.
So this is for a referral letter and transfer letter. Only for these 2, please make a note of it that the past medical history plus the social or lifestyle background will be written in the third paragraph. In continuity of care or an update letter, when the patient is going back to a nursing home that they've come from, or when the patient is going back home or going back to a caregiver's home, that's one scenario, right? And in an update letter, the patient is going back to their own general physician. In these cases, whoever it is from the patient side, they already know about the patient in detail. They know about their past medical history. They know about their social lifestyle background. So we would not want to talk about that in the third paragraph in these scenarios.
Okay, so To sum it up, if it is a referral letter or a transfer letter, you will be writing both past medical history along with the social or lifestyle background.
Exactly.
In an update letter, you will normally not mention it. You will write only about the current medications and dosage.
Exactly. So only the current medications and dosage required in the third paragraph in the second option.
Okay. So when we look at the paragraph 4, paragraph 4 is exclusively for the discharge plan. And we did mention it earlier also. Keep one thing in mind, you should not use everything that is mentioned in the case note, and you have to be clever enough in choosing the points and eliminating what is not required. So that comes in place here. So you have to be very selective in choosing the points to mention in this particular discharge plan paragraph. Make sure to include important points, like it might be something related to the appointments. The patient after discharge might have an appointment with the physiotherapist, or sometimes there might be an appointment for the removal of stitches. There might be information related that to the further tests to be conducted, blood pressure or sugar levels to be monitored. Such important details has to be mentioned in the paragraph 4. So you can say kindly monitor the blood pressure of the patient. So for example, kindly monitor the blood pressure of Mrs. Smith on a regular basis.
Yes.
And if there is something very important, there might be a letter where the patient might be allergic to peanuts. So you can mention that of note, Mrs. Smith is allergic to peanuts. So such important things will be mentioned in paragraph 4, discharge plan paragraph. How are we concluding our letter?
So we will be concluding it with a few statements. You will be using just one statement when you're concluding your letter. It might be referral, transfer, continuity of care, or an update letter. You are going to just use one statement, right? You can make a note of this. You can conclude it with, please do not hesitate to contact me if you require further information regarding. In the bracket, we have written patient's name, so please make sure to insert the patient's name. For example, in this case, Mrs. Smith, we can say that, kindly contact me if you require further information regarding Mrs. Smith. Or should you require further information regarding Mrs. Smith, comma, please contact me. You can also say, in case you require further information regarding Mrs. Smith, comma, please contact me. But make sure and practice just one concluding statement in all your letters so that your concentration will be on the remaining 4 paragraphs and not on the concluding statement.
Okay. Well, how to sign off your letter? There are 2 possible options: yours sincerely, yours faithfully. And you need to know one thing. So it is very important to judge when to write yours sincerely, when yours faithfully. When you know to whom exactly you are writing the letter to. For example, when you know the addressee's name. So, for example, you will be writing a letter to Mr. Max Mullins. So then your salutation would be, dear Mr. Mullins. Then it will be yours sincerely. Sometimes you will be addressing to the designation given. For example, the director, the nursing director, the head nurse, the labor nurse, and then the salutation would be, dear sir / madam, comma. Then you will be signing off your letter with yours faithfully, followed by your designation, whether it might be registered nurse or charge nurse based on the case note. I hope we are clear till now.
You can all drop in a yes.
Yes.
You have followed the points till now.
Because we are yet to start an interesting part.
Yes.
I hope we are working with a case note.
Yes, we are definitely going to be working with a case note, one in detail, and you will also be writing, doing some exercise along with us. So we look forward to your active participation as well. Please make sure to drop in the comment box if you have understood everything so that we can move on to the next part of it.
I hope the session is informative and you're enjoying it.
Well, we do have a question here which says, who requires rehabilitative care and management? Yes, you can also say that. Definitely, you can say that. If the patient is being directed to a specialist at the rehabilitation center, then you can surely say, who requires rehabilitative care and management? Very valid.
Well, any of you have gotten on like half the letters or case notes has to be dealt with. So here are a few testimonials of our students.
And we would really love it if you can take a look at the testimonials because, the students, they're very dear to us. See, when the students come into the Charkos family, we just don't treat them only as an OET or an IELTS candidate, but they become a part of the team, they become a part of our Charkos family. And it is we are like family basically, and we make sure that we are also a part of their journey all through. So the students are pretty close to us, and we really love teaching all the students. They're also the same. We get the same love and affection. So it's really wonderful.
And it's very nice to have a connection with people all over the world, isn't it?
Yes.
So we do have candidates from Nigeria, we do have candidates from UK.
Yes.
And it's nice to know, yeah.
Singapore and other places. So it's always a win-win situation for both of us. We get to teach them, train them, and they also are very happy to stay back in our classes.
So these are the happy candidates of Charkos Global. They were trained under Charkos Global, and I think we can play the testimonial.
Yes. So
hello, my name is Verinsani Rate. I'm from Mizoram, the northeast part of India. I'm currently working in Maidstone and Tunbridge Wells Hospital in southeast England. In order for me to be eligible to work here in the UK, the first exam that needs to be cleared is IELTS or OET, and I chose OET, and I have made the right decision because I have met the best of the best trainer, Ma'am Anusha Bharat, and she is the reason why I am here. I am able to achieve my goals. Thank you, Ma'am Anusha. And her class was lively. I really enjoyed her class. She motivated me nonstop. She encouraged me. There are times that I almost gave up on myself, and but she never gave up on me. Yeah. And she knows her student well. She she recorded our progress, and yeah, and she works on our weak points. Yeah. And then see, I'm here working in the UK as a registered nurse. Thank you, Anusha ma'am.
So, this was a former student of mine named Santi, and we were really humbled by her sweet words. And it is not just about us, it is about the organization as well. She is in constant touch and she's very happy to be there. Let's look at another testimonial.
Hello everyone. First of all, I'm so thankful to God that I was able to clear my examination. And secondly, I'm so very thankful to Nagashri ma'am and Anusha ma'am for helping me a lot. They were really a great support for me in clearing my examination. Initially, I had no plans to join Charkos Learning Center. I had plans to join a center from Bangalore, and we never knew there is such good OET center in Mysore. I got to know about Charkos from my dad's friend, and today I'm so happy, grateful, and I have no regrets that I was a student of Charkos OET Learning Center. I'm so very grateful to Nagashri ma'am and Anusha ma'am. They both are really very kind, very optimistic, and very inspiring teachers. They motivate us in a very positive way. They took a lot of effort and a lot of risk in conducting special classes for all of us, especially for the ones who were taking up the examination. And that advanced tasks they used to share with us were very useful for us. And though I was attending online classes, they used to check on me like how many tasks I used to practice daily and what was the score I was getting. Today, I'm so happy to say for all the OET aspirants to join OET Learning Center of Charkos group of institution and to come out with flying colors and to achieve your goal. Once again, ma'am, I'm so very thankful to you both. The strategies they taught for us, for especially for writing, speaking, and for other two modules as well, were very great, very helpful for me on the day of my examination. Ma'ams, I'm so grateful to you forever. Thank you so much.
So thank you, Valentina, for.
Hi everyone, my name is Nancy and I'm preparing for OET exam with the help of Charkos Global Institute, and my learning experience with Charkos is really wonderful. And if you also want to go abroad for study or work, then I must say you should visit Charkos Global Institute because you can find best faculty and best study material in this institute. And with the help of teachers and your hard work, you can definitely achieve your goal. So all the best for your bright future and have a good day.
Hi everyone, this is Yasser from Hyderabad. Recently, I have cleared my OET with all B score. I took coaching from Dr. Anusha Madam from Charkos Institute. Uh, I'm very grateful that I have cleared my OET, and I'm very thankful to Dr. Anusha Madam because without her it is impossible to clear OET, especially in reading and writing. She is very helpful with her classes, and I'm thoroughly enjoyed her classes every day.
So these are the results for successful candidates. Well, I was not able to wait for this. So let us look at a case note in detail now. So we will be discussing a case note. Please keep your books and pens ready so that more interaction would make the classes lively. I hope you believe that.
And also, please drop in a ready to start.
Yeah.
In the comment box. We're waiting for your message.
Yes. We are super excited to start this section.
Yes.
Have a book and pencil with you. We'll share. Anyhow, the screen is being shared. So we'll be sharing our screen for the case note. So are you ready?
Yes, we do see ready. Thank you so much for being proactive. Well, please look at the screen right now. We're starting off with simple tasks so that you're able to follow the organization of the paragraphs, and everything will be discussed in detail.
I hope the screen is visible. Are you able to see task 1? Well, let me read out the case note. Task 1. Mrs. Pamela Viduka is a 72-year-old patient in your care. She is now ready for discharge. She has just undergone a mitral valve replacement. Name: Mrs. Pamela Viduka. Age: 72. Admitted on 18th November 2008. And the diagnosis is valvular heart disease. So it is mitral valve prolapse. And reason for admission. So this is the presenting complaints: fainting, lightheadedness, chest pain. And the social history says that she is a widow, lives with daughter, no longer drives, smoker for 55 years. Medical history says that she has chronic bronchitis, hypertension, which is a slightly elevated one, 150 by 100, chest infections since retirement 12 years ago. 18th November 2008, she was admitted. So valve replacement, antibiotics, anticoagulant therapy was given, analgesics, and she was prescribed with warfarin. Please note this acronym, BID. And on 19th November 2008, patient put on low salt diet, wears contact lenses, showering dressings with the help of nurses, slowly recovering from analgesics, is able to walk or stand for short periods of time. 20th November 2008, recovered from analgesia, patient educated about causes and preventions of infections. On 21st November 2008, the patient was advised to quit smoking and was also given tips including use of patches. Patient was seen by dietitian. Note this term, RE. Low salt diet, able to walk for longer periods of time with walking stick. 22nd November 2008, patient recovering well, can now shower, dress independently. Still using walking stick, frame. Advised of discharge on 24th November. Vital signs are unremarkable. So on 24th November 2008, patient was told regarding the discharge plan and the patient was discharged. Well, the discharge plan included needs to rest, requires home help to be visited by district nurse, patient to monitor medication usage, regular follow-up examinations, INR to be checked on regular basis, avoid invasive surgical or diagnostic procedures until prophylactic antibiotics are given, oscillatory assessment of heart. Current medication details include warfarin, salpetrol, 3 puffs daily, Mirax, 25 mg daily. And the task, as you all know, it is at the end of the case note, which says, using the information in the case note, write a letter of referral to Max and Mullins, district nurse, 45, Flinders Lane, Melbourne. So this is the task. Well,
we hope you have taken a screenshot of this so that you will be able to work on it as well.
Well, how do we start the letter? What is the first thing that you're going to mention? Can you please comment?
Yes.
What is the first thing that you are going to mention in letter?
So we've already looked at the paragraph requirements, right? So with the paragraph requirements in mind, you can tell us what you'd be stating in the first paragraph. Very quickly, very briefly. You can say that. Okay. Now let's start decoding this case note. So here, when you start, you're of course going to be looking at the writing task first, isn't it? So in that case, you are going to read this first. Here it says, using the information in the case notes, write a letter of referral to Maxine Mullins, district nurse, 45 Flinders Lane, Melbourne, who will provide follow-up care in this case. So we are going to mark our keywords. One thing that you have to know is recognizing the keywords, which is an integral part to this exam. Yeah. So let's look at this. Here it says letter of referral. We'll be highlighting that. The person you're writing the letter to, that is the addressee's name, is given. And here it is Maxine Mullins. The designation of the person and the address is also given. So let us quickly mark that. Now, as you all know, before you start writing, the writing module in itself is for 45 minutes. You have 5 minutes time for reading and 40 minutes time for writing, isn't it? So the 5 minutes that you have, the reading time that you have, you will not be allowed to lift your pencil. If you're taking up a pencil and paper based exam, then you're not allowed to lift your pencil. And for a computer based exam, you are not allowed to start writing. So, we are getting a few answers here. We hope you're able to see the screen. So mark these. Letter of referral to Maxine Mullins, district nurse. And the other words are follow-up care. Okay, we will mark this as well. After looking at this, now that we have already read the case note, we understand that the patient requires rest, requires home help, and you will have to monitor the medication usage, right? And also, they require regular follow-up examinations, INR to be checked on a regular basis, avoiding invasive surgical procedures and auscultatory assessment. These are points, right? So moving to the top, we will first begin with the purpose. So as far as the paragraph is concerned, we'll come to that. But before that, how do we start writing the letter? We start with the date. So here,
so the date of the letter will always be the discharge date.
Yes.
Keep that in mind. The discharge date will be the date of the letter. So what to do if the discharge date is not mentioned? Then you have to go through the case note properly and find out which is the latest entry. So the latest entry done on the date will be the letter, date of the letter. So in this case, it is mentioned. So the patient is discharged on 24th November 2008. So this will be your date of the letter.
So after writing the date, we will be writing other details. So can we just start showing them how to write?
Yes.
Yes. So I'll be typing it here. Please let us know if the screen is visible. So the discharge date is 24th November. So we start off with 24th November 2018. All right. After that,
it is always after the date, it is the address, recipient's address. Whether when it is in this case, it is Max in Mullins, District Nurse, 45 Flinders Lane, Melbourne. Please keep in mind you will not use any punctuation marks.
And the other thing is we are typing it here so that you are able to see the writing task and the block that we are going to write now. If not, you'll be starting on a new page, be it in your practice book, and if it is in the exam, you'll have a new sheet. So after the date,
and actually don't forget that it has to be perfectly aligned.
Yes,
perfectly aligned. We are using a fully blocked letter format to write this letter. Well, the date is always followed by the recipient's address.
So we are leaving a line space in this case so that you know I'm just giving you 2 space. I've given a 2 space marker here. We are writing it to addressing the letter to Maxine. Now understand that Maxine is a woman's name. So we are going to use the name title Miss followed by the full name. Miss Maxine Mullins. Next line, the designation. So the name, after the name, you're writing the designation. District Nurse, address 45 Flinders Lane, Melbourne. So if you see, we haven't placed any punctuation mark here and you're not leaving any space in between the lines. All right, so this is how the block should look. Perfectly indented to the left. So you write the date, leave 1 line space, and then write the addressee block. Fill in the details in the addressee block with the name first, then the designation, followed by the address. After this, leave a line space again
for salutation.
Exactly. So we are going to start with dear. And because the name is given, and as ma'am earlier stated, when the addressee's name is given, you're going to use this formula, dear,
title,
yes, which would be Miss,
plus last name,
Mullins, with a comma.
Keep this in mind. You'll be using commas only in 2 places. I mean, 2 spaces where you write salutation, dear Miss Mullins, comma, and at the end, yours sincerely, comma.
Yes. So in the addressee block that you can see, here is where you're using your first punctuation mark, comma. So dear Miss Mullins, comma. Now leave a line space again. You'll be entering the patient's details. The patient details would be RE regarding, place a colon, space. Okay, I hope you're able to follow this. So the patient is, as you already saw earlier, the name of the patient is Mrs. Pamela Viduka. Mrs. Pamela Viduka clearly stated. So when the name title Mrs. is given, her full name is Pamela Viduka. We are writing the same thing. The age is also stated as 72 years. All right. So let's go down and fill in those details. Regarding the title,
Mrs. Pamela Viduka. Remember, you are going to write full name only here.
Yes.
Rest of the letter, you will be writing only title and the last name.
Yes. And so let's quickly look at one formula that we can place here. I'll put it in the bracket. You can note it down. Name, title, plus full name of the patient, of course. So this is one thing that you can keep in mind. Next, below this, because the age is given, we'll be writing age.
When date of birth is given, you can also write that. Either age or date of birth.
Yes. So here the age is given. We are going to state it as 72 years. And in case the date of birth is given, Please look at this. It's going to be written as DOB colon space. All right. 5th October 1980. Okay, so this is the format. So understand that this is the format that will be required for you to use. There are variations, but we would want you to stick with something very similar to this. So if the date of birth is not given, you're writing the age. Let's look at what we did before.
It is age.
Age is given for Mrs. Pamela Viduka. So
she is 72 years old.
So she's 72 years. This is what we call the block from the date to the date of birth, right?
Now, it is very important because the paragraph we are going to begin writing paragraphs, the body of the letter. So, what is the first paragraph called as? Will you please respond in the chat box? What will you mention in the first paragraph?
So what type of a letter do you think this is? You've already seen the writing task, right? At the end. So the writing task here says, write a letter of referral to Maxine Mullins. So can you tell us what type of a letter this is? You can type it in the chat box.
Yes. Well, Ramana MB has replied as introduction. What is that introduction? Paragraph called as.
Yes. Settings to each and every paragraph. So you can quickly look at your notes that you have written.
Nino Thomas, yes, it is correct. It is a referral letter.
Exactly.
And you have also written introduction paragraph. But we are specifically asking you what should be mentioned in the introduction paragraph, what it is called as.
So this is, yes, it is a referral letter, correct. Thank you, Priyanka. Yes, it is a referral letter. Perfect. Now see, there are a few things that you need to know when it comes to the first paragraph. Who is the patient? The first question, right?
Yes.
So who is the patient?
Mrs. Pamela Viduka. And as already mentioned, I will not be mentioning full name. So it is always the title plus the last name.
And that would be?
Yes, Aarti Krishna has mentioned it as a purpose paragraph.
Yes.
Vishnu M purpose. You are right.
Yes. It is.
Good job.
It is called the purpose of the letter. Well, thank you so much. Now, as ma'am said, it is going to be Mrs.
Viduka.
Yes, Mrs. Viduka is how the patient is going to be addressed throughout the letter. So, the problem with her, I mean, the diagnosis stated that she has valvular heart disease, right? And that on the 18th of November 2008, she was admitted. I'm highlighting that as well. And then it says valve replacement. So the patient has undergone a valve replacement, which is a procedure, right? So now we have to know how the patient is doing, just for our understanding of it, so that it will help us frame the first paragraph. So we understand that the patient has undergone a valve replacement. And how is the patient doing now? So, after having undergone the valve replacement surgery, we have to understand how the patient is doing. There will either be two scenarios. For example, the patient may be doing well, may have, or may be recovering from the procedure, or the patient still requires a lot of support from the nurse. These are two scenarios that you have to keep in mind. Moving on, when we read the case note, we understand that the patient has been put on a low salt diet and prescribed certain medications, isn't it? Moving further down, if we look at the date, which is 22nd November 2008, it says patient recovering well. Now, you may have the question, why is she talking about all these details of, which has to actually go in the second paragraph? Why is she talking about that now? Well, the thing is, if I understand whether the patient is recovering well or not, I will be able to state the same in my purpose.
All right.
Okay. So in case like Pamela Vidukas, we understand that she has undergone a surgery and that she's also recovering well.
Oh.
Yes.
So can we start it like this? This is to refer Mrs. Viduka.
We can surely do that. We'll start writing the letter and leaving a line space after the the date and the addressee block. Leave a line space and start the paragraph. This is to refer, or you can also say, I am writing to refer. So you have two options, two functional phrases to start your first paragraph with. So I'm writing to refer, or this is to refer. Mrs. Viduka. Keep in mind, you will be addressing the patient with this formula: name, title, plus last name. We will get to the details of this, the specifics of all of this, the name and how to address them and everything. But here, just for your reference, we are writing it this way. But let us restart the first paragraph in that sense. So, as ma'am said, this is to refer
Mrs. Viduka.
Mrs. Viduka, comma. Punctuation is important. This is to refer Mrs. Viduka, comma. Now, we understand that the patient is recovering well after the surgery. So, what would you suggest that we write?
Then I would suggest who is recovering from.
All right.
Valve replacement surgery.
From
valve replacement surgery.
All right. Replacement surgery. Okay.
Okay.
Shall I end the sentence? Shall I place a full stop?
Yes.
Okay.
Now we'll have to write, why are we writing? We are writing to refer Mrs. Veduka. And how is the present condition? She is recovering from valve replacement surgery. Now, what is the requirement?
Exactly. So, what will we state? What does she require? According to the writing task, the words that we have blocked here is follow-up care. So, follow-up care, and of course, we have to request the person we are writing to for monitoring the medications, regular follow-up examinations, and everything.
Yes.
So that comes under managing the patient, right?
Yes.
So management is one word. So can we just pick up this word and management and write it here?
Sure. She requires follow-up care.
Follow-up, a hyphenated word.
And management. from your department. Okay. And we do have the discharge information here. So it's clearly, the case note clearly indicates that she is being discharged on 24th. So we can mention that. We have two options again here. Either you can put a comma and write being discharged, or you can end the sentence here and you can write it, she is being discharged today.
All right. So shall I place a comma and continue?
Yes.
Okay. Department
and is being discharged today. Why today? Because you are writing the letter on the same day, 24th November.
And it is also stated here that she is discharged. So that is the reason we have added this.
So don't write again that she is being discharged on 24th November. Rather than that, you will be writing today. She is being discharged today.
Yes.
So simple, isn't it?
It is.
It is.
It is. So I hope you've understood the specifics of this particular paragraph, because you're saying this is to refer Mrs. Viduka. As I already stated, the purpose has answers to 3 WH questions. One is, who is the patient? We have answered it, Mrs. Viduka. What happened to the patient, or what is happening? Then she is recovering from wall replacement surgery. That is also answered. Why are you writing to the specialist? You're requesting for follow-up care and management. So that is done. And along with these 3 WH questions, you've answered one more question, when? And that is being discharged today.
Today. Okay. So what does the second paragraph requirement say? What will you mention in the second paragraph? Start replying.
So we do have a question here. Minu has asked us, and RC as well, why is the full name of the patient not mentioned in the first paragraph? Valid question. Because you've already given the full name of the patient in the reference, isn't it? So you've given the full name of the patient in the reference block here. And that's the reason you don't have to mention the full name again in the subsequent paragraphs. You don't have to. You'll just have to say Mrs. Viduka. As I said, the name, title, and the last name should suffice. You don't have to necessarily be saying the same thing, because that is mere repetition. It is like how we address another person. For example, we can address, if the name is Mr. Anand Krishna, then you'll be addressing them as either Anand or as Mr. Krishna. You won't be addressing them by their full name all the time.
I hope you got the difference. If you're using the title, it is title plus last name. If it is the first name, then it is always addressed without title.
Yes.
So Dr. Anusha Bharat can either be called as Anusha or Dr. Bharat.
Yes. So this is how it's going to be in the letters. And moving on to the second paragraph.
Current medical condition.
Correct. Correct. The current medical condition. She has given us the title. Very happy. So here, let us just look at the points that are going to be included in our second paragraph. So with the 8 points that we had already stated before, first one is the admission date, right? So we have the date of admission being 18 November 2008. Then we have to talk about the presenting complaints or symptoms. And here it is. You have reason for admission, which talks about fainting, lightheadedness, chest pain. Yes. So we have 3 factors to be noted in the presenting complaints. That's done. And then we will be talking about the assessment, right? What was our assessment of the patient, and what happened after that? So we are going to look at it here. She has undergone a valve replacement after hospitalization, and then she was commenced on warfarin, analgesics, antibiotics, anticoagulant, warfarin again as an anticoagulant. So she was commenced on these therapies, and we have already spoken about that. The patient has not had any complications. If you look at the 19th November, again, we don't have anything. She just requires the help of nurses for showering and dressing because that is the very next day after surgery.
Yes.
So if you're looking at the 22nd of November, the fifth day after the surgery, it says that the patient is recovering well and is able to shower and dress independently, but still uses a walking stick or frame. Other important thing is the vital signs being unremarkable. So these are pointers that will go into our second paragraph. Shall we start writing the second paragraph?
Yes.
Yes.
So we can start with admission details.
Yes.
When you're starting the paragraph, it is very important to start with the name. Mrs. Viduka.
Mrs. Viduka
was admitted on 18th November.
18 November 2018. Is it?
Yes, it is.
2018. So guys, please make sure to mention the year as well. We tell our students to do that because sometimes the simple reason being a patient may have been in the hospital, say October of last year, right? October 2023. And that stay may have extended up to January 2024. So in that case, you have 3-4 months of timeline to be included in the letter. So it is always better that you give us the year of admission as well.
Okay. Following this, you will mention the presenting complaints. So in this case, it was fainting, lightheadedness, and chest pain. So Mrs. Viduka was admitted on 18th November 2018. Please remember, after date, you are going to separate it with a comma.
Yes.
Comma with complaints of fainting. There are 3 different complaints here, so you will separate them with the commas. Fainting, comma, lightheadedness, and chest pain.
Okay.
Hope I'm right.
Yes. Yes.
Okay. Then you have tried about the diagnosis. What was the diagnosis, by the way?
So the diagnosis was mitral valve prolapse, for which she underwent a valve replacement surgery.
Yes.
Isn't it? So
Yes,
if we
yes.
move to the top of our case note, we understand that the diagnosis, see,
Valvular heart
disease, mitral valve prolapse, for which she underwent a valve replacement.
Okay. So can we start writing the next 10 sentences as she was diagnosed? Why she was? Because the admission was on 18th and you're writing the letter on 24th.
Exactly. Yes.
She was diagnosed with valvular heart disease. And when you have found that, that is why you have done a mitral valve replacement. So here is where
she was diagnosed with
the connectors can be used.
Yes, she was diagnosed with
valvular heart disease. And the subsequent procedure was performed. So obviously, when you find a disease, you will definitely, when it is a valvular heart disease, definitely what is that going to be done? It is the valve replacement. So instead of writing that, you can write subsequent procedure was done. Procedure was performed. Yes. Okay. What is the next thing? Is there any commencing? Is there any commencement of the medication? Look at it. Respond in the chat box.
Looking at the case note, we understand that she was treated with antibiotics, anticoagulant, analgesics, right? Let's change the color for some colorful screens.
Yeah, done. So we are done with the diagnosis. we have also mentioned that the patient was admitted and a valve replacement surgery was done.
Yes.
And now when we look at the commencement, she was commenced on.
Start time. She was
commenced on.
commenced on.
There are three things again here: antibiotics, anticoagulants, and analgesics.
All right.
She was commenced on antibiotics, anticoagulants, and analgesics. What else was done during her stay in the hospital?
In the hospital, she was actually educated about causes and preventions of infections.
Yes, Priyanka has replied. During hospitalization, she was commenced on antibiotics, anticoagulant, and analgesics. Good. Therefore, she underwent the surgery. Good.
Really
it's nice to know that they're very reciprocative.
Yes.
They're responding.
So she was educated about causes and preventions of infections.
Yes.
And she was also advised, an important factor here is, she was advised to quit smoking and she was given tips regarding the use of patches.
Right.
She was also seen by a dietitian regarding low salt diet.
Okay.
But the important factor here is because the patient has been a smoker for 50. The patient has been a smoker for 55 years, which in fact has led to her current condition.
Yes.
And that's the reason
they have educated her.
Exactly.
Okay.
So she has been educated regarding the prevention and she has also been given advice about how to quit smoking.
Okay.
Okay.
So how can we write that?
So we are going to just say that she
Can we just say that she received education, or can we say she was educated?
She was educated.
Okay.
She was educated.
Regarding?
Yes. She was educated regarding.
Can we say causes and preventions of infections?
Yes.
She was educated regarding causes and preventions of infections.
Yes. Of infections. Regarding causes and preventions of infections. Or do you want me to add anything else, or do you think this is fine?
I think this should be fine. What do you find?
I think this is all right as well.
Can we just mention about her smoking habit in the second paragraph in the past medical history?
No, I think that would go to the third.
Oh, sorry.
Yes.
Third paragraph, in the past medical history. Exactly. So there is nothing to mention about the education regarding smoking here.
No, yes. We'll just keep it to the third paragraph.
So then I think we can directly move to how is she presently.
All right. Correct. So let us look at those points on the top of our case note.
So patient is recovering well.
Yes. Important. We've already marked it.
Yes. So one is able to take shower independently, walking with a stick or frame.
Yes.
I think we'll include these three points and frame a sentence out of it to end our second paragraph.
Yes. Always remember you're going to end your second paragraph with the current status of the patient. So she is recovering well or she's currently stable. Things like these, sentences like these or stems like these to be used to complete the last part of your second paragraph.
Presently.
Yeah. Okay. Presently,
comma. She is recovering well.
She is recovering well,
comma. And is able to.
And is able to.
Shower and dress independently. comma. And we should also mention about that she is able to mobilize. Okay. So we can use the connector here as well as.
Right.
As well as. I think we have to separate it with a comma after dress independently, comma.
Thank you for that.
As well as.
As well as.
As well as mobilize with a stick or frame.
Oh.
Frame.
Done.
I think this is absolutely okay because we have started with the admission details, presenting complaints, the diagnosis. We've also spoke about what procedure was done, what was she commenced on, and we have also told that she was educated regarding a few things and paragraph with the details of her present status.
Yes.
Where she is recovering well, able to shower, is mobilizing with a stick.
Yes. You can always, when you have completed the second paragraph, make sure to go through all the points once so that you haven't missed out on any of those important 8 points that is required to complete your second paragraph. All right. So if any factor was given, if you can remember, for medications in the bracket, we have put if any, and for complications also, we have stated if any. So in this case, if any, only if the patient has had any complication, then that gets stated in the second paragraph. If not, 6 points to be included in the second paragraph are all here.
Well, I think the viewers have also understood the concept very well. See, Priyanka has replied, now she is recovering well. When we asked about her current status, and Kathy has also replied that she is recovering well and independently shower and mobilize.
Yes.
So it's nice to know that they have understood the concept.
Yes. So we are happy about it. Now,
what is the next paragraph about?
Yes, the third paragraph.
Waiting for your replies.
This is a referral letter, guys. This is a referral letter.
What will be the third paragraph about? Start replying in the chat box.
We will understand if.
So we have written the purpose of the letter.
Yes, that's done.
Current medical condition is done. So what's the next thing that we are going to, or we should talk about in the next paragraph? Waiting for your replies. Please use the chat box to reply for the questions.
Yes, we do see somebody has said past medical history.
Harshavardhani has replied, it's past medical history. Good. Yes. You're absolutely right.
Yes, because this is a referral letter. And always remember, referral letter, transfer letter will have the first option of stating the past medical history first and then the social background. So let us look at the past medical history and social background of this patient in the case note. Moving to the top.
Yes, Priyanka has also replied past medical history and social background. Shanish has replied past medical history. Good.
So this lady, the patient, has a medical history of chronic bronchitis, hypertension, chest infection since retirement 12 years ago. And her social history says that she is a widow who lives with her daughter, no longer drives and smoker for 55 years. See, very clearly, I'm just going to strike out no longer drives because that is of no use in my case note here.
Well, I think we have to tell them while writing, especially this paragraph, they have to be very careful. When you pick some points to write about the history, it should have some relevant connection with the present condition.
Exactly.
For example, if the patient has a problem like asthma, if they had a green stick fracture earlier, I don't think that is giving any connection here. So such cases that can be eliminated. That is where you work smart in using the right number of words.
Exactly. And also, this is how you detect a distractor in a case note. So you are going to, as we've already said, connect relevant details. Okay, so you're going to connect relevant details through case keywords that you find in the writing task and also the discharge plan. Connect it and then start framing your letter as we've been doing right now. So,
well, in this case, I think all 3 points are very relevant for present condition.
Exactly.
So we have to talk about it. We have to mention chronic bronchitis, hypertension, and chest infection since retirement 12 years ago.
Yes.
And smoker as
one of the reasons why she has undergone the surgery as well.
And Joshua has also replied past medical history and lifestyle background. Thank you.
Yes.
You're absolutely right. So again, we'll start. Mrs. Viduka has a medical history.
So also keep in mind that you will be stating the patient's name once in each paragraph. As you can see, we have addressed the patient as Mrs. Viduka in the first, the second paragraphs as well. And in the third paragraph also. After that, we'll be using the pronoun she.
Well, see, our viewers are very smart enough. They've already started typing the paragraph.
That's nice.
So Pastorvadini has shared Mrs. Viduka is a known case of bronchitis, hypertension, and also had chest infection since past 12 years. Good?
Yes. One thing, Harshavardhini, that we'd like to tell you is, I think you can let go of the words known case, because you don't have to state that in your letter. You can simply say Mrs. Viduka
has a medical history of.
Yes. Apart from that, it is perfect. Thank you so much. Has a medical
history of bronchitis.
Sorry. Of
Bronchitis, hypertension, and no. Instead of and, I think we can say along with.
Yes.
Along with.
Yes. Along with
chest infections.
Chest infections
for the past 12 years.
For the past 12 years. Now, if you see, we have used the word past 12 years. If you're using since, that is one case and past is another case, but don't use it together. All right. So for the past 12 years, shall I place a full stop?
Yes. And I think we'll have to tell them one thing. Many people or many candidates will have the confusion between from, when to use from,
yes,
and when to use since. On a simple note, let us tell you that when there is something that is as a starting point and end point. For example, the YouTube live classes are held from 2 o'clock to 4 o'clock. So there is a beginning and end. In such case, you will use from. When you use since, it is still associated with. For example, when we say Raymond since 1954.
Yes.
They started their branding in the year 1954 and they are still existing.
Yes, they're still there in the market. So that's why.
So when we say we are associated with the company since 5 years, it does mean that we started our journey 5 years ago, but we are still associated with it.
Yes.
And when we say that I worked in this organization from this year to this year.
Yes.
So it has a beginning and an end.
Yes.
So an additional information.
Yeah, that is for sure. I hope this is helpful for all of you. So infections for the past 12 years.
Okay, now we have to write about our social background.
Yes.
So we have come to know that she is a widow. Anyhow, we can mention that she is a widow, who lives with her daughter.
Right.
And very importantly, we have to tell her she is a smoker.
Very important.
Daughter, put a comma and say and has been a smoker.
Has been a smoker for the past
for 55 years.
Okay.
For 55 years.
55 years is a long time. Yes. Very long time. Has been a smoker for 55 years.
Yes, it's simple. It's done.
This
we have spoke about, or we have mentioned about her
everything.
past medical history, which includes bronchitis, hypertension, chest infection. All might have their contributions to her present condition.
Yes.
So we have not eliminated any of the details there. We have included all three conditions that is mentioned in the case note.
Yes.
And when it comes to the social background, obviously, she no longer drives is something that we have eliminated. But
Exactly.
we find there's no use here.
It is of no use.
That will not fit in here.
It won't. And the reason we are stating she's a widow who lives with a daughter is because you're writing to the district nurse. The district nurse will be visiting the patient. So you require, the address and details of the patient's caregiver as well. So that is why we have very briefly stated that she lives with her daughter. And smoking has been is an important factor, and that is stated. Shall we move on to the fourth now?
Yeah, it sounds very simple, right?
It is very simple.
Okay, we'll ask them. What should we mention in the fourth paragraph?
Yes.
The final paragraph.
Yes, the final paragraph, and you can give us the headline that we've used to talk about the fourth paragraph.
Yes. What will you mention in the fourth paragraph? Please use the chat box to reply for our question. What will you write in the fourth paragraph? Or what is the fourth paragraph all about? Yes, discharge plan.
Yes, exactly.
Good. Yes.
So let us look at the discharge plan first. Taken points that we are going to add in our in the letter that we are writing. So here it says needs to rest, requires
also replied
to be visited by district nurse, patient to monitor medication usage, regular follow-up examinations, INR to be checked on a regular basis, avoid invasive surgical diagnostic procedures until prophylactic antibiotics are given.
So Vivi has a question. Is it okay to write smoker?
So she has been a smoker for 55 years. You can say that. That's not an issue. Or if you're not comfortable saying that, you can also say she. We usually use the word smoker for a person who has had the habit for a period of time. Yes, you can surely say that. No problem. So here in the fourth paragraph, what are we going to add in our fourth paragraph? The fact that the patient needs to rest.
It is very, very important.
And home health.
Yes, it is also important.
Monitoring medication.
Yes.
And are we going to talk about follow-up exams in INR?
Yes. I think most of the things that are mentioned in the discharge plan has to be included.
For this, case especially.
Yeah.
And the fact that we have to avoid invasive surgical diagnostic procedures, all these things are important. So let us just...
Oscillatory assessment of the heart.
Yes, all these.
Yes. And it is very important that the current medication, you have to write about that as well.
Yes.
Warfarin, salpeterol, Mirax. We'll have to write about that as well.
Yes. So current medications in this scenario will go in our fourth paragraph today. So let us move down to writing or framing the fourth paragraph. So
it is a request. It is the request to the addressee.
Yes.
So it should always be in the request form. So you can say kindly encourage.
Kindly encourage
Mrs. Viduka. To rest.
Let me put this in the uppercase. Yes, Mrs. Viduka. To rest.
Comma. And visit her to provide home help. To provide her.
To provide?
Yeah, to provide home help.
Is it a hyphenated word?
No.
No need?
No need.
Okay.
Okay.
Home help.
And then follow-up examinations we'll have to mention. And INR, we have to write about. Yes. So we can state she requires.
Okay. She requires
a regular follow-up examinations.
Follow-up hyphenated.
Yes, it is. Follow-up examinations.
Okay.
Comma. And checking of her INR.
Checking of her INR.
Yes, full stop.
All right.
And then auxiliary assessment has to be done.
So let's just say that she has to undergo an auscultatory assessment.
Should
so
that go in a request mode?
Yes. I'll say please conduct. Shall I say that?
Yes.
Please conduct an
oscillatory assessment of her heart.
Of her heart. Yes, then?
Can we just get back page up so that we know? Yes. Can we just strike out of whatever we have written? Needs to rest, home health.
Yeah, we've done that. We've also spoken about medication. We will be mentioning that because we'll put it under an off note, right?
It's very important to monitor her medication.
Medications.
Okay. About it. I think out of these points, monitoring medication has a special role.
Yes, because it includes her current medication of anticoagulant warfare, salpeterol, and Mirax.
So can we write off note, monitor her medication usage, and then we can include the medicine's name.
Sure, we'll do that. So here, let me just conclude this. Please conduct an auscultatory assessment of her heart.
Full stop.
And
yeah, there is some.
And we should
avoid.
Yeah. That can actually be, you can or you may or you may not include it in the fourth paragraph here because you're writing to the district nurse. Anyway, I'll state it and avoid invasive procedures, right?
Yes.
Invasive procedures. Avoid invasive procedures until prophylactic antibiotics are given. Let's say that until antibiotics
are given.
Full stop.
Now we'll write off note.
Yes, we will write the off note. See, this part, I'll keep it highlighted. You can actually, you don't have to necessarily write this. You can place a period after heart and move on to off note as well. So off note.
Well, you have to be very careful while writing off note. The spelling of off note is OF space NO2E.
Yes.
One of the viewers has mentioned OFF.
So it has to be OF only. OF, off note is nothing but most importantly, or to state something which is very important. So off note, O uppercase, F, 1F, lowercase, off, space, note, comma. Off note, comma.
Her medication, monitor her medication usage.
Her
medication usage.
Which includes
warfarin, salpeterol 3 puffs per day, salpeterol 3 puffs per day, and Mirax 25 mg.
And Mirax 25 mg. So
I think we'll have to tell them that point.
So
there is no necessity of using the uppercase
exactly
or the name of the medication.
Yes, if you are starting your medicines, the name of your medicines here with an uppercase. For example, if I say warfarin with a capital W, then the S in salpeterol should also be written with a capital S. Okay, if you're starting with an uppercase for the medicines, then that continues for all the medicines. If not, you can just leave it as it is, and it can just be like this: 3 puffs per day and Mirax 25 mg
daily. It's a daily dosage.
Yes, daily dosage. So daily, full stop.
And that's fine. I think we have included all the important information. So signing of the letter.
Signing off the letter, I think I'll be using this concluding statement today in case you require further information regarding, we have
Mrs.
to write the
Viduka.
patient's name, as we said, Mrs. Viduka, comma, don't forget the punctuations, regarding Mrs. Viduka, comma, please contact me, as in the registered nurse. Please contact me.
Of course, the other options are,
yes,
please do not hesitate to contact me
if you
require further information regarding Mrs. Viduka.
Yes,
kindly contact me for further information regarding Mrs. Viduka.
Or should you require further information? Instead of in case, then you can use should you require further information. So these are stems that can be used for your concluding statements. So how will we end the letter? I think that is a point that you made during the beginning of this session. So
what will be the complementary close here? We know the addressee's name.
Yes, we do.
We are addressing it to Miss Maxine Mullins.
Yes.
So
we've also given the salutation as Dear Miss Mullins. So we have addressed the name of the person. The addressee's name is given. So when the addressee's name is given, you will be ending your letter with yours sincerely. So when you know the person you're writing the letter to, use sincerely. When you don't know the person you're writing the letter to, use faithfully. So you're sincerely registered nurse. So that concludes the letter.
Yes.
So we hope you have understood today's session, and let us just have a very quick review of what we have done today. So it has been about letter writing, the letter writing module, for which you have 5 minutes of reading time and 40 minutes of writing time. And the word limit is between 180 to 200 or a little more than 200, which can go up to 210 words. That's fine. So moving on to the paragraph requirements. First paragraph will state the purpose of the letter. Please make sure that the purpose is perfect. All right. The purpose has to be perfect. You're going to answer 3 WH questions: who, what, why, along with when, if at all the discharge date is given. So that's the first paragraph. Second paragraph states the current medical condition of the patient. Right? The current medical condition has the following points of when was the patient admitted or presenting complaints, then assessment, diagnosis, then comes the treatment given, medications if any, complications if any, and always remember to end your second paragraph with the current status of the patient. Right?
Well, the third paragraph includes the details of past medical history and the social background. And the fourth paragraph, it's all about the discharge plan, where you are requesting the concerned person. In this case, it is monitoring medication, and there are a few assessments to be done, which you have mentioned about it. And it is very important to mention the medication details.
Yes. It is. So we hope you have followed all these paragraphs and always never forget to conclude it properly. Use a concluding statement that you may have already written down, that we have already shared with you. And also, please keep in mind these formula that we have stated as full name, the name, title, full name, all these things. All right. And sign off with yours sincerely or yours faithfully, depending on the addressee block. Make sure your letter is neatly written, indented to the left, and everything is in place. Another important point before we end this session would be to keep in mind three important C's of letter writing. One is content, next is clarity, and the other one is conciseness. So, content, make sure you select appropriate content. So, selecting appropriate content leads to better clarity in your letter and also makes it concise. So, these threes are integral to letter writing. We hope that you have followed this session, and in the next session, in the next YouTube Live, we will be discussing more case notes, and you'll also get to work on a few and make sure you're there again the next week. That will be next Wednesday at 2 p.m.
We assure you that we'll be discussing different kinds of letters. For example, we did discussion about referral letter today. We'll be discussing about transferring letter of transfer and update letters in the next few classes. Hope this was an informative session. Please give your feedback in the comment section. And if you have any questions to be asked, you are free to do it. The session is open for discussion now.
You may ask any questions, you may post it here in the comment box.
Well, very shortly we'll be posting a WhatsApp community link. You can please join the community using that link for more updates regarding the YouTube live classes.
And thank you, Priyanka. Very kind of you. Thank you, Kathy.
Thank you, Kathy. Thank you, Priyanka. So if you have any queries or doubts or any questions to be asked, please use the chat box for the same. The session is open for discussion now.
So the link to join our WhatsApp community has been posted in the comment box. You may please click on it and join us.
For the more updated information regarding the YouTube live classes.
Yes. And so we have a question here. Can you explain what is off note? Well, off note is nothing but an important information that has to be stated, or which the addressee, the person you're addressing the letter to, that person has to know what it is. So in this case, you're writing to the district nurse who is going to provide some home help, meaning they're going to go to the patient's house and take care of them. They'll be conducting follow-up exams, checking the auscultatory, checking their respiratory rate and everything. So in that case, it is very much important for them to also know what medications the patient has been using. And so here in this particular letter, we have stated off note, which is nothing but important note. That is all it is. Monitor her medication usage, which includes warfarin, salmeterol 3 puffs daily, and Mirax 25 mg daily.
If you can take one more example, if I am writing a letter to Dr. Anusha Bharat regarding a patient named XYZ, so that patient is allergic to penicillin. It is very, very important.
Yes.
So, Dr. Anusha Bharat will make a note of it that the patient is allergic to penicillin.
Yes.
Sometimes it might be the dietary advice. Patient might be allergic to peanuts or allergic to lactose.
Yeah, maybe
something
lactose
like that.
Yeah. May have the removal of stitches in, say, in a week's time. So in that case, you'll just be stating off note. Off note, an appointment with the surgeon is scheduled next week at 1 p.m. So you will be stating that in off note. And we have another question here which says, ma'am, if we cross 200 words, will it be a problem? Definitely not, Ms. Shanish. It won't be a problem. You don't have to worry.
But it doesn't mean that you can write 220 words.
Exactly. So it has to be within, say, 205, within 210 words. That would be fine. 1 or 1.25 of a page should do. Or sometimes even if it goes to 1.5, that is also fine, because sometimes our handwriting is different. Yeah. Some write in with small letters and some, their handwriting is a little different. So I think that shouldn't be a problem. And why do we mention it in an off note? As ma'am has already stated, it is an important point for them to make a note of. That's why we state that important factor under off note.
So this YouTube live classes is scheduled on every Wednesday at 2 p.m. So the link of the community WhatsApp community is posted in the chat box. Please use the link and join the community for more updates regarding the YouTube live classes. Well, we hope this session was informative. Thank you for your valuable feedback.
And your time as well. We look forward to you joining us again next Wednesday at 2 p.m. sharp, right?
Signing off, Nagashri S. Vivek,
Dr. Anusha Bharat.
See you.